Today, we're pulling back the curtain on the science that tracks, hunts down, and ultimately stops disease right in its tracks. Let's get into it.
I mean, really think about that. A new virus pops up out of nowhere, or some strange sickness starts making its way through a town. Who are the people that show up to figure out what on earth is going on?
Well, they have a name, epidemiologists. And honestly, their job is a whole lot like a detective's. They're out there, on the ground, looking for clues, figuring out who the suspects are, and trying to solve the mystery of how and why people are getting sick. Okay, so here's the official textbook definition. I know, it sounds a little dense, but just focus on 3 parts. Distribution, that's just the who, where, and when. Determinants, those are the causes, the risk factors. And the most important word here is application, because this isn't just about studying things, it's about using that knowledge to actually control health problems. It's the science of action.
So, let's dig into what makes these public health detectives so different. How does their work compare to, say, the doctor you go see for a checkup? And here's the absolute key difference. Your doctor is focused on you, the individual patient that walks into their office. An epidemiologist, on the other hand, is looking at the health of the entire community, the whole population. They don't sit back and wait for sick people to come to them. No, they actively go out and hunt for cases to understand the bigger picture.
You know, every good investigation has to start with gathering evidence. And for an epidemiologist, that evidence, it's all data. They've got to count the clues to really get a handle on the size of the problem.
These are the first 2 giant questions they need to answer. And to do that, they have very specific tools to measure just how common a disease is. It's all about getting the basic facts of the case straight from the get-go.
And to answer those questions, they use 2 core measurements. Think of incidence, like the speedometer of an outbreak. It tells you how many new cases are popping up. It's all about speed. Prevalence, on the other hand, is more like a snapshot. It tells you the total number of people, new and old cases combined, who are sick at one specific moment. So one tells you how fast it's spreading, the other tells you the total burden right now.
A number like this represents another absolutely critical clue. It's called the case fatality rate, and it tells our detectives exactly how deadly a disease is. If you see a rate of 1 in 800, that means for every 800 people who get sick, 1 person sadly won't make it. This one number can completely change the urgency and the entire public health response. Okay, so once that initial data is in, the real detective work can begin. Now it's time to sift through all those clues and start hunting for patterns. Who's getting sick? And more importantly, why?
Think of this flowchart as the detective's roadmap. It shows all the different paths their investigation can take. It all kicks off at the top with what are called descriptive studies. That's just observing what's going on and coming up with a theory. From there, they move into analytical studies to really test that theory. And sometimes they can even move to experimental studies, like clinical trials, to get the strongest possible proof. It's a complete roadmap from just seeing something to proving it. The first move is always descriptive. It's like a detective arriving at a crime scene and just taking it all in. They gather the basic facts: person, place, and time. Who are the victims? Where is this happening? When did it all start? This is how they form their initial hypothesis, their primary suspect, if you will.
Now, once they have a theory, they need to test it using analytical studies. 2 of the most common are the case control study, where they start with people who are already sick and look backwards in time to find a common cause. Then there's the cohort study, which is the total opposite. They start with a healthy group of people and follow them forward in time to see who eventually gets sick. A case control is faster, especially for rare diseases, but a cohort study, while it can take years, usually gives you much stronger evidence.
But listen, just finding a link or a pattern isn't enough, not even close. Now our detective has to build a completely airtight case. They have to prove, beyond a reasonable doubt, that one thing actually caused the other.
This is the million-dollar question in this entire field. Just because 2 things happen together doesn't mean one caused the other, right? I mean, ice cream sales and shark attacks both spike in the summer, but one doesn't cause the other. So how in the world do they tell the difference?
Well, to get to the real culprit, they first have to rule out a couple of imposters.
The first is a spurious association. That's just a fluke, pure random chance. The second is an indirect one, where some hidden confounding factor is the real bad guy. It's only by eliminating both of those that they can finally prove a direct causal link.
So to truly prove causation, the absolute gold standard is the randomized controlled trial, or RCT. By randomly sorting people into either a group that gets a treatment or a group that doesn't, they can wipe out all that bias and those sneaky confounding factors. That's why people say randomization is the very heart of a trial.
It's what makes the comparison fair and the results believable.
But you can't always do an RCT. So when that's off the table, epidemiologists build their case kind of like a prosecutor, using a checklist. Did the cause come before the effect? Is the connection really strong? Are other studies finding the same thing? And, does it even make biological sense? The more boxes they can check, the stronger their case for causation becomes.
Look, this whole investigation isn't just some academic exercise. The entire point is to get answers that lead directly to action, to stop the current outbreak and to prevent the next one.
And this is what it all boils down to, the action plan. It moves in this really logical way, from first, just confirming you have a real problem, to mapping it all out, then to testing your theory about the cause, and finally, the most important step, implementing control measures. It's everything we've talked about, laid out as a clear plan for action.
The ultimate goal here is to break the chain of transmission. See, a disease spreads from a source through some mode of transmission to a susceptible person. Every single public health action, whether it's washing your hands, wearing a mask, vaccines, quarantining, every one is designed to do one thing, break a link somewhere in that chain.
And the ultimate victory in this whole fight, the end game, it's achieving what's called herd immunity. When enough people in a community are immune, it creates this kind of protective wall. The virus just can't find enough vulnerable people to keep spreading, and the outbreak sputters out. It's how we protect everyone, even those who can't get immune themselves.
So, from counting the first clues to proving a cause and finally breaking the chain of infection, epidemiology gives us the blueprint for protecting public health. It's the science that stands between us and the next major pandemic. The tools are there, the knowledge is there. The real question is, how well are we prepared to use them?